I'm a PGY1 resident. So after going through pharmacy school, I decided I wanted to go into residency. And this seemed like a really good residency for me. It seemed like a good fit. So that's how I applied through the forecast system and then came out here.
Cool. What was like the process in like deciding you wanted to do residency and then the actual application and the interview process?
Wow. So I decided, when did I decide I wanted to do residency? I probably decided around third year. Because, in the beginning I wasn't really sure what I wanted to do. I didn't know that much about all the different options. And then somewhere around third year, I was talking to the fourth year students and then the ones who had just graduated. I knew some people who had gone into a residency. It seemed to really open up more doors about future jobs. And it was a way to continue learning. So that's one thing I really like, that I didn't want to just go get thrown into a job and have to know everything all of a sudden. Because fourth year, when you get there, you probably won't feel like you know everything. You never get there. But now I feel like I'm learning a little more each day, and I can slowly build my knowledge base. I first went up to Boston for Boston College to get my undergraduate degree. That was in psychology with a minor in health science. And then I finished that, and I worked for a while. I was an EMT for 2 years. And then I worked in research for about 5 years, and then did all my prereqs for pharmacy school, and then applied all over, and got into University of Washington in Seattle. And then I went there for pharmacy school for 4 years, and now I'm here.
Okay. During pharmacy school, what were some of the things that helped you survive, like the workload and the rigor of it?
Definitely my friends. I needed a strong network of friends to help me stay motivated, to study with. We would study in groups a lot, so we would get together on Saturdays after class, whenever, just to really go over the material, make sure we knew what we were talking about, and we helped each other out a lot. So if I didn't have that, I don't know how I would have gotten through pharmacy school.
Was teaching something you ever imagined you'd start doing when you first started school, and if not, like what were some other career options that like you may have thought about, but then it ended up being pharmacy that you chose?
Mm-hmm. So, you mean when I was in pharmacy school, or
before starting pharmacy school? Like, where did you kind of see yourself being, and was that the end result as to where you ended up?
Yeah, so I always knew that I wanted to be in some kind of medical field. Originally, I was thinking of going to medical school, and actually applied right after college, and didn't get in. I was waitlisted from one of the DO schools, and then I went back and kind of redid a lot of prereqs and rethought about what I wanted. And when I was working in research, we had this patient couple, which they were both pharmacists, and I didn't really know much about pharmacy then. They kind of talked to me about what pharmacy is and what kinds of things they do and all their patient interactions, and it sounded like a better fit for me. It sounded more of a place where I can, have a family and have time to be at home, and also have time at work and make a difference in patients' lives and not be on call all the time. So, and it was more chemistry based, or so I thought, and I was kind of had a thing for chemistry.
What would you say is the most misunderstood or misconstrued idea people have about pharmacists or other health professionals have about pharmacists?
Yeah, I think that pharmacy is changing a lot right now, and I think that people still, maybe not healthcare professionals, but people outside of the healthcare field still have the view that pharmacists are, dispensing and just looking at medications from a pharmacy standpoint. They don't realize that they're working in hospitals, that we're in ambulatory care clinics, teaching, and there's such a wide variety of things that pharmacists can do, which so many people just are not aware of. Even my mom's a nurse, so she kind of knew more about it, but my dad, he works in school with computers, and it was kind of a big thing for him to learn that pharmacists can immunize, and just see. Now he asks when he gets his flu shot, are you a nurse or you're a pharmacist? What are you doing? So now he, it's that level of information that is kind of slowly seeking through, I think.
Would you say you keep your feelings from clouding your decision-making process when you're at work, or if you ever feel conflicted, how do you keep it professional?
Yeah, that can be tough. It can be tough in a lot of different circumstances. I do remember one time when I was working in dispensing pharmacy, and we had a patient. Lots of times, patients will get angry about their medications. They'll be upset because something's not ready fast enough, and we had one patient who was upset because his medication wasn't ready yet, and of course it was a pain medication. And he just pretty much starts off the bat yelling at me, and I'm an intern. I had just started there. I didn't even know, what was wrong or what could be done or what to even say to him. So that was really hard. And after a while, it was just like, okay, well, I'm gonna have you talk to my manager. And I had to walk away and just take 5 minutes and just start breathing again, and try to just put it out of my mind and say okay, there was nothing there I could have done. I didn't cause this problem. I'm just gonna have to let go of it. And I think it's really hard to not internalize that, not to personalize what other people say, because a lot of things he was saying was, this is your job. Why don't you do your job? You should have this done. And I was thinking to myself, well, maybe I should have this done. Maybe there is something I should have done, but you can't internalize that. You can't blame yourself for all this.
Do you see the role of what the pharmacist is doing expanding even more over the next 5 years or 10 years, or how do you see it developing?
Yeah, absolutely. The role of pharmacy is expanding incredibly right now, and it's really exciting. It's a really exciting time to be here. I think that pharmacists are heading into clinics and heading into places that they didn't really have access to before, and they're able to, instead of talking to patients about medications they've been taking for the last however many years, they can talk to prescribers and recommend medications that they should be on based on guidelines. And I'm working in a clinic as one of my rotation blocks through this residency, and it's been really fulfilling. I've just been able to talk to so many different providers and curb patients' medications before they even get placed on them. So we're not trying to retroactively change something. We're doing it beforehand, and it's very rewarding.
What is your perfect or ideal pharmacy job where you don't have, if money wasn't a limiter or location or anything, what would you be doing within the field of pharmacy?
Yeah, so I think that what I'm doing right now, at least in the clinic, it's just so amazing. And I would love to do that as a job, working in an ambulatory care clinic, get to see patients, talk to them, talk to providers, try to help them decide on certain medications. That would be my ideal job.
Sure. And have you had a mentor or somebody who's really helped you along the path, or someone who's during the time when you felt that you weren't sure pharmacy wasn't what you wanted to do, that really helped push you to get to that next level?
So before pharmacy school, mentor or
whatever. Yeah.
Yeah, I mean, I've got a lot of mentors throughout the years, and I don't know where I'd be without them. So it's hard to narrow it down to just one or two, but I think in pharmacy school, I had a mentor who was a teacher. She was one of the pharmacy school faculty members, and she was really able to help me to see, how to effectively teach and how to develop lesson plans and do things like that. And that kind of got me more into a mindset of wanting to teach students down the road too. But yeah, I've had lots of different mentors in different areas of pharmacy or before pharmacy school, and they've all really been able to kind of help shape who I've become, I think.
What would you say is a couple, some of the best pieces of advice that you've gotten that have really stuck with you and that you would pass on to anybody who wants to pursue a career in pharmacy?
So before pharmacy school advice, so I'd say, be prepared to work hard. It's a lot of work, it's a lot of effort, but it's really rewarding in the end. And there's just so many different things you can do and so many ways you can change a patient's life that you can really make any job that you want out of pharmacy, because there's so many areas you can move into. So I'd say, as advice, what did I say? Be ready to work hard, and then just try to stay motivated try to remember, why you want to do this and where you're headed, and don't let the little things get you down. I mean, there's going to be bumps, there's going to be bruises, but in the end, you'll make it and you'll get there and you'll be fine.
Sure.
And that's coming more from a teaching perspective because I'm seeing students a lot nowadays. So.
Mm-hmm. Would you have any other additional pieces for students who want to pursue a residency specifically?
Yeah, definitely. I think finding a mentor would be really helpful. So talking to someone who's been through the process, who you can look up to, who can kind of help you in different areas in getting ready for applications, looking for letters of recommendation, different types of residencies there are. I actually did have another mentor who kind of helped me develop my CV, helped me write my letters of intent, and helped me figure out which residencies I wanted to look for. And that was really hard because it's really hard to look through their system and find the different residencies that are out there because they're so different. So I would say just look for a mentor and try to prepare early and just always be thinking about where you want to be in that next step.
What is your greatest strength, and how do you think that enables you to be a better pharmacist?
Well, I think I've always been a people person. I've always been really friendly, really kind of easy to get along with. I think that's what people told me. So I think that really helps when I'm talking to patients, when I'm counseling. I actually had some feedback from one of the students we had on rotation, and she told me that whenever I go in the room, that the patients always feel much calmer. They feel they're able to talk to me for some reason. So it's really nice to be able to get patients to open up and just to kind of understand where they're coming from, because you really can't ever get them to a point where they're really taking care of their health until you understand what they want to get out of it and where they're coming from. So that's probably been my greatest strength.
And can you tell us a little more about your research?
Yeah, sure. So after doing the EMT thing for 2 years, I worked with the Harvard School of Public Health in Boston, and we did research on patients with diabetes, type 2 diabetes, and we looked at air pollution effects. So we were taking air pollution monitors and basically took samples of the air at home, and it compared how much air pollution they were getting when they were at home, and it looked at their lung function tests. So we did samples when they were in the clinic, looking at how much air pollution they had in their lungs, how their vascular tissue was working. So we did a brachial artery ultrasound, which actually looked at the diameter of their artery, and we inflated a blood pressure cuff and then released it. Normally your artery should expand or dilate, and in patients who had a lot of air pollution exposure, they didn't have that dilation as well as other patients.
Thank you for your time with interviewing with us today, and we hope that you had as good of a time as we did getting to learn more about you.
Yeah, absolutely. Well, thanks so much. Great to see you all again, and I hope all goes well.
And action. Okay. Yep. Go. Did you hit his butt?